There's a screening and evaluation that should be done for almost everybody that goes to the hospital, just that we don't do it. Okay, and you are screening these people to actually pick up lipid disorders early enough to be able to treat them. Okay, so it's known as what we just have an overview of it. So screening and evaluation for lipid disorders. So you are trying to check if the person has a possibility of developing any lipid related disease condition later on in life. Okay, so that's why you are doing this. So screening and evaluation for lipid disorders. So you are trying to now, as you are doing screening for lipids, you are trying to measure all these types of lipoproteins to see their levels in the body. All right. So screening now, we see that the National Cholesterol Education Program, that's the adult treatment panel 3, that's NCEP ATP3. In their 2001 guidelines, they actually recommended that all adults older than 20 years should have a plasma cholesterol, triglyceride, low density lipoproteins, high density lipoproteins measured after an overnight fast. So if you want to measure any of these things in the body, you don't measure it when the patient came to the clinic when they have eaten. No. You ask the patient to not eat throughout the night and they should come to the clinic in the morning without eating. That's when it is now suitable to measure any of these things. Okay. So these are the different lipoproteins. So now for low density lipoproteins, it is calculated using what? A Fried-Wild equation as follows. If you want to find the amount of low density lipoproteins in the body, you just say what? Total cholesterols, all right, minus triglyceride over 5. That's the total amount of triglyceride in the body over 5. Then minus high density lipoproteins. Okay, so for me, from this equation, you can be able to now find any other one that you want. Okay, let me say if I want to find out for high density lipoproteins, I can just switch it down here. Do you understand? That's after I do for you to find this, that means definitely they gave you this, right? So you can just switch it there. And all right, so from the Fried-Wild equation that is stated like that, you can be able to find for low density lipoproteins. That's if you know the total cholesterol, if you know triglyceride, and you know high density lipoproteins. You can be able to find high density lipoproteins if you know low density lipoproteins, total cholesterol, and triglyceride. Okay, you can be able to maneuver all those things using that formula. So this formula is accurate in the fasting sample and if triglyceride levels are less than what? 200 milligrams per dl. So now if triglyceride levels are greater than 200 milligrams per dl, the guidelines recommend that non-high density lipoproteins can be calculated as follows. Non-high density lipoproteins is what? Just total cholesterol minus high density lipoproteins. If you are saying non-density lipoproteins, that means you are saying about any lipoproteins in the body that is not high density lipoproteins, including what? Low density lipoproteins. You know, we have low density lipoproteins, we have very low density lipoproteins, we have the IDL. So all these ones are non-high density lipoproteins. They are not high density lipoproteins. Okay, so if the triglyceride levels are more than 200, you can just calculate them using this simple formula right here. So further evaluation and treatment is based on the plasma low density lipoproteins, because the low density lipoproteins are the bad guys, right? So for you to now know which type of treatment to even start with for a particular patient, you have to know the levels of what? These low density lipoproteins. You have to know the levels of other lipoproteins in the body that are not high density lipoproteins. Then you also assess the overall cardiovascular risk of the individual. All right. So to convert triglyceride to millimoles per liter, okay, to convert triglyceride in millimoles per liter to milligrams per dl, just multiply it by 88. To convert low density lipoproteins in millimoles per liter to milligrams per dl, just multiply it by what? 38. All right. So these are the normal range that these substances are supposed to be in the body. Right, so you can just pause this video to look at this table, and this table summarizes the normal ranges that these things should be in the body like that. All right, so that's it guys, and bye for now.